Magandang araw sa inyong lahat. I'm Dr. Gerald Vilela, and for today we will be discussing an important topic, and this is acute gastritis. It is defined as inflammation or pamamaga ng lining ng stomach natin or ng lining ng ating sikmura. This lining of our stomach is very important since it produces acid, which helps in the digestion of food that we eat, and also mucus production para ma-prevent niya po yung pamamaga ng lining ng stomach natin. There are two types of gastritis. This is acute and chronic gastritis. If the occurrence is sudden, this is what we call as acute gastritis. At kapag matagal po yung nararamdaman ng isang pasyente, ang tawag namin dito ay chronic gastritis. So what are the causes of gastritis? When you say acute gastritis, it's mostly because of erosive gastritis. This means that the lining of the stomach ay na-erode. And this is because of so many medications that we're taking. These are what we call the NSAIDs or the non-steroidal anti-inflammatory drugs. These are medications which we take to control the pain. Most of the time, patients with arthritis or chronic pain are the ones who use NSAIDs. Patients who take antibiotics can also have acute erosive gastritis. There are different beverages which can cause erosive gastritis, and most commonly, this is alcohol intake. Ano ba ang dahilan kung bakit nagkakaroon ng chronic gastritis? Ang most common cause ito ay infectious, which is the most common bacteria is Helicobacter pylori. This is a bacteria which most of the time causes inflammation or infection of the lining of our stomach. At kadalasan, yung mga pasyenteng mayroong peptic ulcer disease ay meron ding Helicobacter pylori dun sa ulcer nila. Ano po bang nararamdaman ng isang pasyente na may gastritis? Kadalasan ay ang pagsasakit ng sikmura nila o pangangasim ng sikmura. Dito po sa gitna, but most of the time, there is radiation of the pain at the left upper quadrant or right upper quadrant, or it goes through at the back. So, ito yung pangangasim na parang ginugutom ang pakiramdam nila. Also, there are episodes na nagko-complain ng pasyente ng nausea, o parang napapasok ka sila, or dili kaya napapasok ka na because of sobrang pangangasim ng sikmura. So, why should we be afraid of gastritis? Kadalasan, ang gastritis is a precursor for peptic ulcer. And also, merong mga pasyente na nagkakaroon ng polyp o dili kaya ay benign or malignant neoplasm or cancer ng stomach. Paano ba natin ginagamot ang gastritis? Most of the time, we advise the patients to do some lifestyle modifications. So we usually try to advise them to avoid eating sobrang spicy, sobrang maaasim, or sometimes caffeinated drinks like coffee, tea, or even soft drinks. But there's a product in the market which is known as Kremil tablet. And Kremil is composed of 3 active ingredients. First is aluminum hydroxide, and the other one is magnesium hydroxide. These first 2 ingredients would neutralize the acid in the stomach. While the third one, simeticon, it reduces the gasiness o pagkakaroon ng bloatedness o hangin sa ating sikmura. The small bubbles, kino-coalesce niya to form larger bubbles para it's easier to expel. So Kremil S would relieve gastric acidity and as well as gasiness. So what is acid neutralizing capacity? This is the ability of the antacid to neutralize the acid in the stomach. And the US FDA, or the Food and Drug Administration, has set a minimum standard of 5 milliequivalents as the minimum ANC. And based on a study, Kremil has an ANC of 13.86. At ito ay maliwanag na 2 times more than the ANC set by the US FDA guidelines. Kaya nga, pagka ikaw ay may gastritis, pwede kang uminom ng Kremil sapagkat ito ay may 2 times ANC. That's it for our discussion on gastritis. Ito po si Dr. Gerald Vilela at maraming salamat po sa inyong panonood.